Hi, I'm Ted Kruse with Physical Therapy Solutions, and today we're going to talk about the frozen shoulder. So, frozen shoulder is a common diagnosis that we see here in physical therapy. The medical term for it is adhesive capsulitis. And with frozen shoulder, the one thing we can tell you is that we don't know a lot about why it comes on. There is no specific cause to a frozen shoulder or adhesive capsulitis. We do know the most common age group are women around 40 years of age. But as far as what brings it on is completely unknown. We'll have patients that have had an injury that has initiated the onset of adhesive capsulitis, and oftentimes for most patients it's completely insidious or has no cause or injury to set it off. What frozen shoulder is, it's actually tightening of the joint capsule. So for your shoulder, the joint capsule are these ligamentous structures around the ball and socket joint, the ball of your humerus and the socket of your shoulder blade or scapula. And at random times, with no injury or an insidious onset, that joint capsule can start to tighten up and restrict your range of motion and also be very painful. The most common symptom that we hear people starting with is that they notice their shoulder was sore and became tight, had difficulty reaching overhead, oftentimes for women reaching behind their back, for instance, to undo or strap their bra, tucking in a shirt or putting on a belt. This doesn't go away over time, and eventually they'll come in to see us or talk to their physician about it and have the diagnosis of adhesive capsulitis. The best thing we can do is treat you early. We work on range of motion and we're fairly aggressive, making sure that we don't irritate things further to gain that range of motion back. And I would say typically if we can get to somebody early and gain that range of motion or work on that range of motion, they have a good outcome early on. Sometimes if that frozen shoulder has kind of set in and has been around for a long period of time, it is tough to work that back out. Given time, they will often resolve themselves. Hopefully physical therapy will help to speed that process up. If the tightness is too great and we can't loosen it up in therapy, another option, seeing an orthopedic physician, would be to possibly have an injection to try to decrease some inflammation, pain, and tightness in that joint, or also have what's called a manipulation, where they will put somebody under anesthesia and stretch through that shoulder and that joint capsule to break up any adhesions or restrictions. Again, going back to physical therapy following to get that range of motion back and maintain it. If you have any questions on frozen shoulder or adhesive capsulitis, please give us a call at Manchester or Dyersville Physical Therapy Solutions. Thank you.